Okay, I'm scanning the environment now. Okay, hello. My name is Jasmine, and I'm gonna be your nurse today. I'm gonna do your physical assessment that involve touching of your skin. Is that okay?
Yes.
Okay. All right. I can see that the patient has she's alert and oriented times three, and her stated age is appears to be normal, and then her nutritional level is she's well nourished, and her uh, hair position, posture and position, she's sitting erect and the position is normal, and I can there is no sign of physical deformities, no mobility issue, and there is no the movement is also normal, and then the facial expression is normal, mood and alert is normal, the hearing is normal as I heard her she heard me talking, and then her speech is the articulation is with the normal pattern, and the um, the patient personal grooming is she's well groomed. Next I'm gonna do is to measure your vital sign. Can I check your radial pulse? Okay, the radial pulse is strong and regular bilaterally. And now I'm gonna check your respiration rate. I can see that it's normal and regular rate as it rises and up. Next, I'm gonna check is your vital blood pressure. But first, I'm gonna do is to touch your skin for your temperature, and it's it's a normal and it's warm to touch. Okay, your blood pressure is 115 over 75, which is very much normal to her age. So, do you have any pain?
Yes, I have a headache.
Okay, when did it start?
Yesterday,
And what's bring it on?
when I'm standing up,
Is it like radiating from your head to the other part of your body?
no.
What's the quality? How does it feel?
Pulsating,
And from the scale of 1 to 10, where is your pain there?
7.
Okay, so what do you take for your, what do you do for your pain?
I drink Advil.
Okay, and what do you think is the causing of your pain?
I can sleep very well at night.
Oh, okay. So next I'm gonna check is your skin. Okay, you can you move like this a little bit so I can, yeah, that's it. Okay, now your skin is the color of your skin is appropriate to your ethnicity. It's moist and it's not dry, and no lesion, no lesion, and your nails are pink, and the capillary refill in 2 seconds, which is normal. Okay, and next I'm gonna do is your head and face. Okay, your head is a normocephalic aligned with the spine, and Your scalp is any tenderness, any pain?
No.
Okay, it's intact, it's normal, and there's no lice and there's no infestation. Now with the facial, I can see that your face is symmetrical, no facial drooping, and there's no facial drooping, no involuntary movement, and they're symmetrical. Now I'm gonna check your temporal artery. Any pain?
No.
And then your submandibular joint, any pain?
No.
And your sinuses, frontal sinuses, any pain, tenderness?
No.
And your maxillary sinuses, any pain?
No.
Okay, so they're all intact. So next I'm gonna check is your eyes. Where is the this one? Okay, can you look up? I'm looking at conjunctiva. They're both pink, and then the sclera is white, and then the cornea and the iris have no discoloration color. There's no color discoloration. The eyes are symmetrical. There's no strabismus, and there's no lid lag, and there's no involuntary movement. Now what I'm gonna do is to check your cranial nerve number 2, which is the confrontation or peripheral vision. Okay, so from the back, I will run my finger to the front and say now if you're gonna see it, not moving your head. Okay.
No. No.
Okay, so the cranial nerve number 2 is intact. So the next I'm gonna do is your extraocular muscle, which is the cranial nerve number 3, 4, and 5, and this is the cardinal position of gaze. Okay, don't move your head while my hand is running from the back. Okay.
No. 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 No.
Okay, so the cranial nerve number 3, 4, and 5 are intact. So next I'm going to do is your corneal reflex. So the corneal reflex is intact as it's blink when it touches to the cornea, touches the tissue paper. Next I'm going to check is your accommodation, the accommodation to the light. So okay, so can you open your eyes? Okay, so the accommodation is normal, and it's reacted to the light accommodation, and it's constrict from 4 to 3. Okay, so next I'm gonna do is your ears. Okay, your ears is symmetrical, and your ears is symmetrical and online. Your ears is online and symmetrical. And now I'm gonna palpate your tragus and your pinna. Any pain, tenderness?
No.
Any pain, tenderness?
No.
Okay. It's they're all normal. So what I'm gonna do next is to check your external meatus by pulling the pinna up and back. So the auditory canal is pinkish in color, no erosions, no erosions, no the tympanic membrane is intact, and there's no bulging. And I'm gonna see the other side. So the tympanic, the pin I'm gonna pull in back. So the tympanic, oh no, the external auditory canal, it's a pinkish, no erosion. The tympanic membrane is intact and no bulging and no erosion. Now I'm gonna test your hearing. I'm gonna test the Weber test. Just hear the vibration, okay, and check if it's which one is hearing louder than the other one or equal, okay?
Equal.
Okay, so the patient has no issues with the bilaterally because she hears normal. And then we're gonna do the Rini test. Okay, you let me know if you cannot hear anymore the vibration and say now, okay?
Okay. No. No.
Okay, so the air conduction is longer than the bone conduction, which is normal. Okay, next I'm gonna do is I'm gonna check your nose. Okay, your nose is equal bilaterally, and the septum is in the midline. The nasal turbinate are pink, they're moist, and there's no polyps. And can you occlude one nostril and snip to the other side? Now do the other side. Okay, the nose pattern is intact, and now we're gonna do the smell test, which is the smell test, which is the cranial nerve number 1. Okay, can you close your eyes and then occlude your nostril? Can you smell? What are you smelling?
Vicks Vapor.
Okay, that's good. And do the other one.
A lotion.
A lotion. So the her cranial nerve number 1 is intact. Next, what I'm gonna do is to check her mouth and the throat. Okay, so your mouth, your lips are pink. They're pinkish. There's no cracks, and there's no lesion. Can you say E?
E.
So the teeth are white, and there's no dental caries, and then the gums, there's no swelling, there's no bleeding, and can you say ah?
Ah.
So the soft palate and then the uvula is rises when you say ah, and then the tonsils are pink, the pharyngeal wall are pink, and the tonsils are pink also, and they are 2+. Can you move your tongue side by side? Okay, the tongue is pink, and it's in the midline. There's no discoloration, there's no deviation, and also it's in the midline. Okay, next I'm gonna do is to check your neck. Okay, the neck is symmetrical, the trachea is in the middle, and there's no jugular distension. Now I'm gonna do is to check your lymph nodes. First I'm gonna do is your pre-auricular lymph node. Any pain, any tenderness?
No.
The post-auricular lymph node, any pain?
No.
Tenderness?
No.
Okay, so occipital, any pain or tenderness?
No.
Okay, and then the superficial, is it, okay, so let's just go to submental, any pain, tenderness?
No.
Submandibular,
No.
any pain,
No.
tenderness? Okay, so the lymph nodes are they're normal and they're normal. So next I'm gonna do is um, okay, can you do like we're gonna check your cranial nerve number 11. This is can you shoulder shrug like this? Shrug it. So, okay, it's the cranial nerve number 11 is normal, and then can you do like your neck flexion? No, flexion, extension, and then rotation. Okay, so the neck flexions or reflexes are normal, and there is no it's normal as it can move from side to side. So next what I'm gonna do is to check your chest and lungs. So your thoracic cage is a conical shape. There is no cyanotic sign, and there is no extramuscular accessory. No, sorry, there is no extra accessory muscle used, and I'm gonna palpate now. I'm gonna palpate for your tactile perimeters, and each time I'm gonna put my hand, you're gonna say 99, so I can feel the vibration. Okay.
99, 99, 99, 99, 99, 99.
So the tactile perimeters is normal as but the vibration or the air is going equally to the lungs. So next I'm gonna do is to palpate. So it has resonant sound, and going down to the breast, it becomes dull, as it has fat, so which is normal. So next I'm gonna do is to check the upper extremities. Can you do the pronation first, and then supination, and then flexion, and then extension, and then rotation, and then the other side. So I can see they're all the flexes of the upper extremities is normal. Okay, now can you lie down, please? Okay, I can see that I'm gonna check the neck. Kita ba? Okay. I'm gonna check your neck vessel. So there is no jugular distension, and I'm gonna check your the carotid bruits. I'm gonna listen to your carotid bruits. Take a deep breath. So there is no carotid bruits. So next what I'm gonna do is to check your heart. Okay, now I can see that your heart, the precordium is symmetrical, and okay, and your heart is symmetrical, and also there's no hips, no lift, no lesion I can see. Now I'm going to check your the heart sound, which is I will check the aorta. The aorta is no. First, I'm gonna check is your apical impulse, which is it's right here, and this is the fifth intercostal space from external border, and this is 2 centimeters from above 2 centimeters above below the nipple. Now I'm gonna do is to check your aorta. This is second intercostal border, the second intercostal space on external border. So I can hear that it is S1 is louder than S2. Now I'm going to pulmonic area, sorry. I can hear that S1, um, SS2 is louder than S1. And then I'm gonna go down to a third intercostal space, the Erb's point, which is S1 is equal to S2. And then I'm going down to pulmonic bulb, which is S1 is louder than S2, and then I'm going to mitral bulb, which is located in the fourth intercostal space. I can hear that S1 is louder than S2, and going forward to look for the S1 and look for the extra sound, which is the S3 and S4. You can sit down. So I'm gonna continue with the S3 and S4 to look for the murmurs too. So they're all, it's regular. I cannot hear any murmurs. So next I'm gonna do is the abdomen. Oh no, sorry, you can lie down again. So I can see that the abdomen is flat, and the abdomen is flat, and it's symmetrical. Now I'm gonna hear a sound. First I'm gonna do is to inspect. So it's flat, it's a normal, there's no bump, it's a regular color. And next I'm gonna do is to auscultate for the sound. So I'm gonna look for the right quadrant, lower quadrant, and then upper right quadrant, and then left upper quadrant, and then lower left lower quadrant. So the sound is normal, and also it's the sound is normal, and now I'm gonna check for the aortic sound for any bruit, which is located above the umbilicus. So there is no bruit sound. So there's no bruit sound I hear. They're all normal. Now I'm gonna check for the lower extremities. Okay, the lower extremities, I have to check for the pulsation. This is the femoral. The femoral is normal and equal bilaterally, strong, regular. And then the popliteal is right here. It's normal, regular, and equal bilaterally. Now I'm going to the tibialis. I'm gonna check both. It's right here. It's beyond the how do you call this bone here. The ankle, it's in the here inside anterior. So the popliteal is the tibialis is regular and strong, equal bilaterally. And now I'm gonna check for the pedis pulse, which is it's right here. So it's gonna be in line with the big toe. So I will do it in both. It's bilaterally they're equal, strong, and regular. Okay, so next what I'm gonna do is the neuromuscular test, and to be able to do that, you can stand up, and Okay. Can you hold my hand? Can you close here? And okay. Can you grip my hand? Okay. The grip is strong, and okay. Do like this, and push it against me. Okay, and then the grip is normal. And now can you stand up for 20 seconds and close your eyes? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So what's this? This one is a normal too. As it's okay. You can open your eyes. It's okay, and she's not. The movement is okay as she's not falling while the eyes is closed. And now what we can do is that's the Romberg test. And then now what we can do is your toes, do like this up your toes, and then okay, can you do that? And then down, and then up and down. So the flexes are also normal. Now what we're gonna do is tendon reflexes. Okay, they're all this is normal too. The bicep, the tricep, the brachialis, and sa baba. Then I'm gonna check now the Babinski, the plantar. Oh, it's now it's curl. It is normal. Okay. And then can you stand up? Can I see your back? So there's no varicose. It's a normal. The leg is normal. So that's it. Thank you so much.